Well, it's good to be with you in Garland, Texas. Did not realize I was going to be here till a few weeks ago. I was actually scheduled to be at a big health conference in Michigan that got canceled a month ago. I don't know exactly why it did. It postponed a year, so they asked us for a year later. And right after that, I got a text from your pastor saying, any chance you can come out that weekend? And normally we're booked a year in advance, and there's no way that would happen. But since they had just canceled, it seemed to be that God wanted us here this weekend in Garland. So glad to have you here. Let me see if I can get us to have you see the screen here. All right, it looks like we might be there. Yes, we are there. So our first evening, we're going to be giving 3 talks. So one tonight, one at 11 a.m. tomorrow, and one at 5 p.m. Tomorrow. At the 5 p.m. one, and after, you'll get a chance to meet my son Nathan. He actually lives over in the DFW area on the other side, Decatur, Texas. And you might have seen him if you follow us at all on the Let's Talk Mental Health series. We do some interviews in regards to mental health issues, and he'll be bringing over materials and educational materials and products to help physical and mental health that you'll be able to peruse. And then Sunday morning, fortunately, our trainer that trains people how to put on community programs in depression and anxiety recovery lives in the San Antonio area. So when he found out I was flying up and he had this weekend free, he came up here. I'd like you to meet Jared here. Jared, maybe you can come up.
Thank you, Dr. Nedley. It's great to be here.
Yeah, so Jared came across our materials as a result of coming through the residential program at Weimar University. Weimar University, we have 2 lifestyle center programs. We have the New Start program for physical health issues, and then we also have a mental health lifestyle center for depression, anxiety, and other mental illnesses. Also addictions, we deal with some of the most severe addictions as well. And I think Jared was given an ultimatum by his wife. Is that how it was? How did you end up coming?
So my wife is a nurse, and she was tending to her patient, and she happened to come across Dr. Nedley on the Hope Channel, and she came home and said, you need to go see Dr. Nedley or else. And that was pretty much all it took.
And so he came, and it turns out, even though he was working, Jared has a military background, so very organized, but he was out of the military and was working. He wasn't quite all there for his family or for his job. Do you want to mention what was going on?
I was there physically, but emotionally I was a shell of a human being. I had been trying for about 15 years at this point to get well, to overcome depression, anxiety, and the self-medication that went hand in hand with that. And by this point, I had been labeled a treatment-resistant case, and I was pretty much labeled as hopeless until I came and met with Dr. Nedley.
And so the first few days, it was a little tough because of what we call withdrawal. And you know, the things he was self-medicating with were no longer available. These weren't prescription drugs, right?
Well, there was one, opiates. Well,
okay,
I had
that's right.
some injuries from my time in the military, so opiates were one of the many things I came in with at that point.
And so it was a few days of pretty significant withdrawal symptoms where he really couldn't engage in the program. And a few days in, finally some of that withdrawal started to subside, and we have something called contrast baths. It actually helps with withdrawal, but also helps with mental health. Let me explain a little bit about the typical ways that mental illness often presents itself. It often presents itself because of our own behaviors in doing what's called dopamine surges. How can you do a dopamine surge? Well, one of the ways is getting on YouTube just to watch a very funny video and the dopamine levels go up. But then you want to do it again, the dopamine levels come down really quick, and then YouTube's very nice to give you a whole lot of other videos that are similar to that one. And so you click again, but each time it doesn't go up as high as it did, and it keeps going down lower as far as the dopamine set point. And it may not be YouTube, it may be meth, it may be, there's all sorts of ways. Sexual addictions will have that dopamine surge, etc. And so the dopamine set point of people, when they don't have this, first they're doing it to get high, but eventually they're doing it just to get numb. And here's what they think. They think, I know this is bad, at least it's not good for most people, but for me, I need it. They think they need it because in between times they've got this deep, distressing sense of deprivation, even though nothing really bad is going on in their life. And so they think they need it to get back up to neutral. And they don't realize that if they would break that cycle of addiction, their dopamine set points would start going up, and they would have dopamine levels that are nice on the high range, not the big spike and then drop, but just going for a walk will bring the dopamine level up. Just having a conversation or a Bible study will bring the dopamine level up, and it doesn't plummet, it stays up for a long time thereafter. But Jared was in this dopamine deprivation part of things, and of course the withdrawal made it worse. But one of the ways in which we can become mentally healthy and break that cycle is to intentionally do dopamine dives that are healthy. We dopamine dives that are healthy, the dopamine level comes down, and when it comes back up to neutral, it just doesn't go to neutral, it actually goes above neutral. I heard about something that your church is doing called a fast. Are any of you fasting right now? Okay, some of you are fasting. I hear the nod. And that fast is actually a dopamine dive that actually can help bring up the dopamine levels above neutral after the fast. I don't know if you've ever noticed after a long fast, if you notice what happens when you start eating just simple food to break the fast. It tastes so good. And there's just a joy in it that you get from eating that you didn't get before, and it's just wonderful. But one of the ways of doing that dopamine dive is contrast hydrotherapy. So you get in a warm tub, and you get nice and warm, and then you go to the cold tub. And studies show it has to be uncomfortably cold to work. There's heat shock proteins that'll actually help your brain to improve significantly after that period. But it doesn't have to be dangerously cold. It has to be what? Uncomfortably cold. So Jared, it was time. He went down for the hydro session. Tell us a little bit about that.
So as Dr. Nedley had mentioned, I was very ill from the withdrawal, not only from the drugs that I was coming off, that I was self-medicating with, but I had also came in on antidepressant medications. And Dr. Nedley tried to talk me out of cold turkey and those as well, but I was adamant that these had not been working for me for years and were causing a lot of other adverse things, such as significant weight gain. And I wanted to try this program with nothing, no chemicals at all. And so I felt really bad for 3 days, and I don't think it was a coincidence that on day 3, I felt this urging to get up and move around, and I left my room. I asked the program director, Linda, I said, I want to participate. Where are the men at? And she said, you're just in luck. They're downstairs doing hydrotherapy that Dr. Nedley was just mentioning right now. And so I go down there, and I'm from Texas originally. I grew up in Giddings, Texas, about an hour east of Austin. And I remember thinking, this was almost 5 years ago, ladies and gentlemen. I remember thinking, the hot part it really sounds appealing. It's probably what my body needs right now. I had no idea what was coming after that. But, I did my few minutes in the hot tub, and you've probably heard the saying before that all good things must come to an end. I got out, and I got into that cold tub, and every fiber of my being was screaming, get out. And so I had this inner dialogue and external dialogue with the staff members, like, no matter what, you will never get me back in that tub. I remember hyperventilating. I remember panicking. Again, like us Texans, we normally don't do the cold water thing. But, so I had this conversation, and on the third time, again, that number 3, right, on the third time of me telling Daniel, there's no way, Daniel, that you're going to get me back into that tub. The voice of God spoke to my heart and said, Jared, if Jesus can be beaten and nailed to that tree for you, then you can get in that tub. And I was never in that moment, I've never been ashamed in my entire life as I was. Because all that flashed before me. I saw our Lord and Savior hanging from that tree. And yet I wasn't willing to get a little bit uncomfortable and listen and take the advice of Dr. Nedley and the staff who knew what they were doing. And it was only by the grace of God and him giving me the strength and the willingness to get back in there that I did it. And you would think that hearing the voice of God would have made those next 2 rounds easier. It did not. It was very difficult, but God gave me the strength to get through. And I remember after the 3rd time, because you do them in rounds of 3 of getting out, immediately I felt this peace and hope. And for the first time in 15 years, my mind was alive. I could think. I had real emotions. And I had the most important thing, and that was hope. That this could change. And I just want to put this one thing in there so you can really see the big picture. For 15 years, I tried desperately everything that any physician could throw at me, and medications, psychotherapy. And I was doing the math on the flight over here. From the year of 25, from when I turned 25 to when I turned 35, I spent over a year of my life in some sort of an institution for mental health, for addiction recovery, from law enforcement asking me very nicely to go with them. So this is the point, ladies and gentlemen. Dr. Nedley deals with the underlying brain biochemistry issues of why we're depressed, why we're anxious, and that had never been presented to me before in my life. And so once when I came out of that water and have that hope, I committed to the rest of the program. And in 10 days, my issue was resolved, and I've never looked back, and it's almost been 5 years. So get that. I just want to repeat that one more time. What wasn't able to be fixed in 15 years was fixed in 10 days. By God's mercy, his love, and his grace, and by the wisdom of this man standing next to me. And I want to encourage you with this. I will be doing the training on Sunday for the community program. A lot of that information overlaps what Dr. Nedley is going to be speaking about tonight and tomorrow, and what he implements and incorporates into his residential program. I have seen countless people overcome addictions to food, to alcohol, to tobacco, to heroin, to pornography, all of these struggles, to depression and anxiety, obviously. So you can take that message right here to Garland, Texas, to your family, to to your place of employment, to your friend group. Once you become educated, you can take that element of health education and coaching and begin to save lives right here. So, thank you.
So since that time that he went through the 10-day program, we actually recommend, because it's kind of an educational course that you're going through as well, and then you're implementing it. But after 20 weeks, all this becomes kind of second nature. And then he took the training to put on community programs in his local area down there in San Antonio. And you've been running those programs now, which is a community health education. That's different. The residential program, we're looking at blood tests. We're looking at the deep biochemistries of the brain and correcting what can be corrected. It's pretty amazing. But we're also having some very expert counselors to get at the irrational thought patterns. The community program does amazing things just by health education and coaching. And so that makes it a whole lot less expensive, and it's just once a night for 8 weeks. There are some people that need the residential program. Jared was one of them. I don't think the community program, probably with everything that you were on, would have necessarily worked. But he's seen so many life changes in regards to the community program. And with his military background in order and organization, we've been doing these trainings for 20 plus years, but Jared gets rated at the top as far as training others. And he'll be doing that Sunday morning from 9 a.m. to 1 p.m. It's an intense training. Normally it's an all-day training, but with what you're able to hear from me this weekend, plus that, we think that will be enough for you with the materials that we also give you to help you to be able to put on a program in your community. And I know it's Pastor Sean's desire that you could put on an 8-week program once a night for 8 weeks right here in Garland, and reach out to the community and to other members that critically need this information to optimize their brain and to help their health. So did I get that right? Is it 9 a.m. to 1 p.m.?
Correct, 9 a.m.
Okay. What time should they be here on Sunday?
Be here before, I would say probably try to be here by 8:30 because we have to register. And don't forget, there's a time change this weekend, so please make sure you set your clocks accordingly. You will get 1 hour less of sleep. I promise you it will be worth it.
All right. Thank you very much, Jared. So, depression and anxiety, it's markedly increasing in our society. And I'd like to go through symptoms. I meet a lot of people that have issues, but they think their issues are different than what their core issues actually are. And sometimes it's not until I go through these 9 diagnostic hallmark symptoms of depression that they realize that they either have depression or anxiety and it was undiagnosed. If it's undiagnosed, you're not likely to do much about it. But if at least you recognize you have it, then there are things that can be done. Most people, when they say they're depressed, they're actually talking about deep sadness. You don't have to have the deep sadness, you might just have the emptiness. Women tend to notice the deep sadness more because they will have what type of spells sometimes associated with deep sadness? Crying spells. Men tend not to get the crying spells, they feel more of the emptiness, and so they'll deny that they have depression because they don't have that. But it turns out you don't need to have either one of those, you just need to have 5 of these 9 diagnostic hallmark symptoms. The second is apathy. This is when you wake up in the morning, you're not excited about the day. You get up out of a sense of duty and responsibility, but not interest. And that can happen to someone once in a great while, but when it happens the majority of the time, it's distinctly abnormal. And things that used to be pleasurable aren't even pleasurable anymore. And you may not even want to even get out of your house. We had a woman come through our program. The last time she had been out of her house, 4.5 years earlier, she had been talked into going out of her house by her relatives, who said, there's a new restaurant in town, I think you'd like it, we're all getting together, why don't you get out? So she got out there, and as she was at that restaurant with her relatives, she was thinking, I just want out of here, and I want back home. And she did not get out of her house for 4.5 years. Her daughter brought her food, and she had to pay others to bring things and do things for her. And the first time out of her house after that was when her daughter drove her to our depression and anxiety residential program. Since that time, she has been out of the house every day since. And she has an interest in life, and she is really finding fulfillment every day. Increase in irritability. This is when things that didn't used to bother you start bothering you more. And often individuals deny this. I was in an interview not long ago with a man who was having symptoms of depression. By the way, there's 100 symptoms of depression. 9 are diagnostic hallmark symptoms. But one of those symptoms is migraine headaches. He had severe headaches. Now, not all migraines are due to depression and anxiety, but many of them are. And then we have to solve that before the migraines get solved. And so I was wondering if he might have had depression. So I started going through this list. Are you more irritable than you used to be? He says, no. And his wife is in the corner saying, oh, yes, he is. I said, you know, your wife just disagreed with you. What do you mean? He says. And she came up with stories of how he had flown off the handle several times in the last couple of weeks in ways that he didn't used to do that. And then he looks at me and says, I guess she's right. I guess I am more irritable. Turns out he had 6 of these 9 symptoms. We were able to cure his migraine headaches by finding out why he had depression and getting rid of the depression aspect of things. Increase or decrease in weight or appetite. Which is more common, weight gain or weight loss? Weight gain is more common. Why is it more common? People will self-medicate their symptoms of depression with food. What food do they tend to self-medicate with? It tends to be chocolate, sweet foods, tends to be unhealthy foods, and it tends to be foods that produce a dopamine surge and are addictive. A recent study was done on the 5 most addictive foods to Americans. Anyone want to guess what's in the top 5? All right, you guys are pretty educated. Number 5 was ice cream. Number 4, cookies. And there's people on a plant-based diet that think they're eating healthy because they're eating Oreo cookies that are vegan. No, those are unhealthy as well. You can be unhealthy on a plant-based diet. Number 3, someone mentioned it, chips. Number 2, chocolate. And what is number 1? Cheese pizza is number 1. Pizza, cheese even has hydromorphones in it. It's kind of like the opioids that Jared was talking about. It can have that addictive nature to it. Now, what do those foods have in common? Fat? Yep, all of them have fat. Most of them have sugar. And all of them also have salt. So salt, sugar, and fat, put those together. It's an addictive food. It's a good way to make a lot of money as you ruin the health of the individuals that keep going back to the addiction. And so weight gain. We'll never solve the obesity epidemic in our country until we solve the mental health issues behind it. So the people that come to our program that are overweight, they all lose weight. I don't remember how much weight you lost, Jared, in 10 days.
19 pounds.
He lost 19 pounds in 10 days. And that weight continued to come off because you are no longer in that need of that self-medicating role. But we also have people that are underweight. Well, people come with BMIs of 15, anything below 18 is starting to get unhealthy. And so they'll be skin and bones because they've lost their appetite and they can't eat, or they get nausea or vomited, and their abdominal pain starts to pick up. And some of them have been put in hospitals, and they've been put on NG tubes and had tubes go down to try to feed them to save their life. And then they come to our program, and they're shocked often with my recommendation that they get physical exercise. They said in the hospital I wasn't allowed to walk at all because they thought I might die from I didn't have enough calories or things like that. And I said, no, physical exercise is important to improve your mental health so that you get your appetite back. They're actually thrilled to be able to exercise. It's like, I've been wanting to exercise and they wouldn't let me do it. And so we have to get to the root of those issues as well. But interestingly, we'll have all these underweight people gain weight in our program, and the overweight all lose weight, and they're going through the same program because we're getting to the root of the mental health issues. Sleep disturbance. What's the most common sleep disturbance with depression? Insomnia is pretty common. That's when your head hits pillow and your mind keeps going. You can't go to sleep. But there's a more common sleep disorder. Sleeping too much, hypersomnia, yes, that also is a sleep disorder. By the way, what is sleeping too much for an adult? More than 9 hours, yeah. 9 hours is always abnormal, and actually health risks increase, including depression, anxiety when you're sleeping too much. We had one woman come to our program. She was sleeping 20 hours a day. And the 4 hours that she was awake, 3 of those 4 hours, she was in her bed directing her family. She was only up for a little less than an hour, enough to stay clean and enough to try to eat something in order to stay alive. And after she came to our program, she hasn't slept over 9 hours since. And she is productive again and all of that. But there's something even more common. Either one of those would qualify. But the most common sleep disorder with depression is you're able to go to sleep, but then you wake up too early and can't go back to sleep. And the earlier you wake up, the more severe the depression. So you might need to be getting up at 6 in the morning. Now you're getting up at 4, can't go back to sleep. And as the depression gets more severe, it's 2 o'clock in the morning, can't go back to sleep. And so we have to reset the circadian rhythm problem. By the way, in our program, our residential program, we do data on both the community and residential. You might see some of that data if you come through the training and what's to be expected. But I think 91% of the people that come through our residential program have one of those sleep disorders. And so we see a lot of sleep problems with depression and anxiety. And of course, many of them have sleep anxiety. They realize it's not good, they can't sleep, and so they're always worried, come bedtime, am I going to be able to sleep? Do you think that helps their sleep? No, just worrying about sleep will cause insomnia. And so we have to work on that aspect as well as far as how they're thinking about it. Decrease in focus and concentration. How do you know whether you have that? You're reading something that's interesting to you. You get to the bottom of the page and you realize you forgot what was at the top of the page. And then you have to go back again and start reading it again. And then it might even happen the second time through. You've gotten down to the bottom and you said, I missed it again. So that can start affecting you academically. It can start affecting your work performance. It can start affecting a number of things, but it's very common with depression. Fatigue. This is not just mental fatigue, it's physical fatigue. You run out of energy too early in the day, or you wake up without the energy, And so the majority of the time of your waking moments, you feel like you have this fatigue aspect. And that's different than the interest. The apathy had to do with interest, but this has to do with energy. So brain energy can be affected. And then the more signs of severity, feelings of what? People will come and tell us that they feel that their family would be better off without them. And they even think that they would be better off dead, and they are convinced that they are worthless. And this is, of course, an irrational thought, because if you have any ability to be of use to yourself or others, you're clearly not worthless. But they are convinced that they are. And that underscores the fact that everyone with depression and anxiety has some irrational thought patterns. They believe things that on the surface seem to be true, but they're actually not true. And they think these negative, repetitive, irrational thoughts. And really, that's kind of the core of mental illness. We all can have some irrational thoughts, and things that are not true sometimes pop up, but we need to be able to correct those thoughts and to investigate them and to think of a different way of us thinking about things. But this is why the cognitive part, we don't just deal with the biochemical part. We also deal with the software of the brain. In fact, we can correct the brain chemistry and recheck it 6 weeks later and find out that the brain chemistry is perfect. But if they haven't taken their LA freeway highways down of irrational thoughts, those irrational thoughts will continue. So that's why it's a combination of the biochemistry and at the same time working on thinking patterns. And that's something that you can even teach in the community program and learn how to do that yourself. And of course, that doesn't make you a therapist. We actually teach individuals how they can become their own therapist so that they're not reliant on counselors thereafter. But, and of course, at Weimar University, it's one of our most popular programs. We have an online, if you have a bachelor's degree and you want to be repurposed in medical missionary work, strongly consider our online counseling degree. It's a master's in counseling. It leads to you being a licensed counselor, and everything is online except the clinical part. And the clinical part, you actually get to come to the depression and anxiety recovery program and shadow our counselors, and then actually be a primary counselor with our counselor teachers in the background to be able to help people compassionately to get to the root of their thought processes that are unhelpful and actually causing them to even get worse. And this is a very rewarding work. We've had a lot of nurses come through our program, our master's program. We've had a lot of nurses come through the residential program as well. Nurses, physicians, lawyers, people from all walks of life that come through the residential program. But we've had nurses not get their master's in nursing, but get their master's in counseling. And so far, every nurse that has done that does counseling for a living and not nursing. Even Ellen White talked about to deal with minds is one of the nicest, most rewarding works. And by the way, I'd like to say something about the form of therapy. The form of therapy, it's called the gold standard of psychotherapy, is called cognitive behavioral therapy. This is what actually Christ did to help people change their mind about things and have them change it into what's more accurate. We actually use the Bible. It's a CBT book, actually. And we can, I wish I had time to actually demonstrate this, but this is the form of therapy that the Bible is very much for. But it's very different than the therapies that are the traditional psychotherapies or the new therapies. Do you know what's more common than cognitive behavioral therapy as far as trying to help people mental health? It's called teaching them in mindfulness meditation. And this is actually really a form. There's different forms of it, all sorts of different names. But this is called Eastern meditation. And Eastern meditation teaches you to be non-judgmental regarding your thoughts. Now, at first, this seems to maybe make a lot of people better. Some people it makes them worse right off the bat. But there are other people, well, if I'm non-judgmental about my thoughts, I can just be at peace with the thoughts that I have. And of course, it tries to train them in regards to meditative techniques and get them into theta wave and things like that. Cognitive behavioral therapy is the exact opposite. And that is shown to blown Eastern meditation and mindfulness meditation out of the water as far as both short-term and long-term results. We actually have to teach people to analyze their thoughts, listen to their thoughts, and see what is not true about their thoughts and correct those thoughts. And this is where the major benefit is going to be seen. And so when people come to our program, we don't do Eastern meditation. We don't do things to make them non-judgmental about their thoughts. We compassionately help them to be able to listen to their thoughts and to analyze those thoughts and to look at them in regards to what's true and what isn't true. And then the last are morbid thoughts. As mentioned, one of those could be thinking that you'd be better off dead, but of course suicidal thoughts would be part of this. Homicidal thoughts are part of this as well. This is, of course, irrational and a sign of severity. So out of those, hopefully you are keeping track. You might see how many of those that you had, but if you have 5 or more, major depression is there. And I would encourage you to come to the community program that Garland's going to be putting on soon as a result of the training that Jared is doing. If you have 2 to 4, that's even abnormal. It's called minor depression. It's only thought to be normal if you have 0 or 1 of those symptoms, as long as the 1 is not those last 2. Feelings of worthlessness and morbid thoughts are always abnormal. This is something, and of course, this is something to help others evaluate themselves as well. Many people don't think they have a need of focusing in on their mental health until they take a test like this and start realizing that there are significant issues. By the way, there's quite an age difference in regards to these thoughts, even in a clinic setting. We run a clinic, we'll have 70, 75-year-olds that come in with 0 of these 9 symptoms. And I'll tell them, you know, you're here for a physical reason, etc. But did you know your mental health is far better than the average 22-year-old we see in this clinic? Because the average 22-year-old, it's going to be up there and significant. We need to be compassionate of our young people. Our culture and some of the things that they've learned have led them into serious mental health issues. And they don't even recognize, what has led them to that point. And of course, it's very important for them to understand that and be able to change what they're doing and what they're thinking. Now, depression, major depression is the single most common mental illness. But anxiety, if we add up all the forms of anxiety, anxiety is even more common than depression. And anxiety, feeling on edge, racing thoughts tend to be a part of it. It's excessive fear or worry is one of the characteristics of anxiety. And there are many forms. Post-traumatic stress disorder is actually an anxiety disorder. Phobias in our young people, but it's also some of our older people. They have significant social phobias, social anxiety. It's at an all-time high. One of the signs that you might have it is if you'd rather text someone across the room instead of actually go up and talk to them and have that full experience in regards to the social aspect. I'm sure there are those who are watching online because they didn't want to have the social experience of coming out here tonight and running into others. And also at an all-time high, social appearance anxiety. Many times it's diagnosed as social anxiety. What is social appearance anxiety? The thought that when you are viewed, you will be judged negatively by others, just as a result of them seeing you. And it's amazing the people that have this, that many people would rate as some of the most beautiful people in the nation, and they have social appearance anxiety. And of course, one of the things that is driving this is social media, because they are comparing themselves with this girl who took 1,000 pictures of herself in different lighting, found the one that looked least like her, uploaded that to her account, and made everyone jealous. And they're thinking, I'll never be able to look like her. Well, they don't realize she can't ever look like her either in regards to that. And so this image-driven society, in fact, studies show the more you look at images, the more mental health issues you're going to have. And I think God knew something about that when the second commandment had to do with images. And not being, bowing down and worship images, which are actually what's being done today. There's more image worship today than there has ever been in human history. And so social media can drive this social appearance anxiety. Of course, other things can do it as well. And then there's other phobias. We've treated all sorts of phobias. Very smart people can have these phobias. We have a physician, one of the top physicians in the Bay Area, that had a phobia about going over bridges. Well, if you're in the San Francisco Bay Area and you have a phobia about going over bridges, it can alter your life significantly. So it would take him 1 hour and 45 minutes more to go somewhere because he wasn't going to go over a bridge. And so we've had people with phobias about buttons. The buttons will cause phobias. We've had people that have phobias about elevators. And fortunately at Weimar we have an elevator. And so after we got to the root of the cause, then we do exposure therapy and have the therapist go with them as they get on the elevator, etc. So there's all sorts of phobias that are out there, which is part of an anxiety disorder that can greatly disrupt them. By the way, obsessive compulsive disorder, also an anxiety disorder. And so this is something that we love to treat, are these OCD things. And then with anxiety, you tend to have a host of physical symptoms, including muscle pain, and many people with feeling of their need of treating their pain. When their anxiety goes away, their pain tolerance goes up significantly, and they may not even have any source of pain, etc. Just an example of how much mental illness has been increasing. This was a study on 16 to 24-year-olds in the UK, the proportion of the population reporting self-harming. This is the age group that tends to self-harm the most, and this is the age, and of course it's the gender that tends to self-harm the most, which is the female gender, although males do it as well. 1% were self-harming in 1993, every 7 years. They look at it again. 2000, it was 2%. 2007, it was 4%. What do you think it was in 2014? Well, if it's exponential, it'd be 8%, 26%. So something happened between 2007 and 2014 to exponentially rise virtually every mental illness went skyrocketed between those 2 years. And by the way, it continues to go up. During the COVID pandemic, they didn't even test it because in 2021 it was COVID. They knew it'd be bad. There were 2 pandemics. There was the COVID that the media was centered in on, but there was another pandemic that was even worse. And it was the mental illness pandemic that skyrocketed. And one of the reasons why it skyrocketed has to do with what happened between 2007 and 2014. What happened in this country? Okay, I'm not sure I heard any of that clearly, but when it went up significantly, was measurably went up in the United States, was 2012. What happened in 2012? And by the way, every country in the world, when this happens, mental illness skyrockets. In 2012 is when 50% of the American public owned a smartphone. They've tested in other countries. Kenya is a poor country, but they were mentally healthy. Happy people. You go to Kenya, they don't have anything. They're not even sure where their water is going to come from, but they're happy. Not anymore. 2019, we went there. Rates of depression, anxiety, suicide was almost unknown in Kenya, and it dramatically was going up, and that was the year that 50% of Kenyans owned a smartphone. So what is it about the smartphone? And this also underscores why our young people are having such issues with mental health. Anyone wonder what it is? You know, by the way, there were things where depression and anxiety went up. After entertainment television came out, it went up. You know, amazingly, what's called the Great Generation, which have almost completely passed to their grave, the Great Generation had probably more stress than any generation. World War II, all sorts of those issues, dying on a massive scale, fighting wars, fighting Japan, Nazi Germany, all of those things. But suicide rates were non-existent. The Depression occurred. The Depression, worst economic period in US history. In 2029, no one ended their life. They would try to find out how to scrub together and move it, but virtually suicide was unheard of in comparison to what we have it now. Now in Vietnam, in that war, you did have suicide. You had PTSD. You had things set up. Now entertainment television is a frontal lobe suppressant due to its rapid scene of reference changes. So television has been shown, entertainment television, to significantly increase depression, anxiety, all of those things. And when the smartphone came out, I must admit, I didn't quite understand it, because I thought it would be better than entertainment television. Why did I think it would be better? You kind of vegetate in front of the rapid scene of reference changes, and you're letting the hypnotic effect take over when the frontal lobe is suppressed, and all this information's going in, you're not critically analyzing it, it's not healthy. Even Bill Clinton, who was largely supported by the Hollywood crowd when he was in office, Bill Clinton actually came out in the 90s talking about the problems with entertainment television. He got his own base a little upset at him, but the evidence was there. It was very clear that this is not healthy for humanity. The smartphone came out, and I thought, well, this is going to be better because people have to make choices on what they're going to click. But let me just tell you what happens. When a student sits down in front of their smartphone or screen or whatever to do their homework, and they have full intention of getting their homework done. Within 3 minutes, they're no longer doing their homework. Why is that? They got distracted. And it may be distracted on things that are pretty neutral. For instance, they start to do their homework, and then the engineers know that that student likes BMWs. So a little BMW starts floating across the screen, and it says, the new A5 is at your local dealer. And that student thinks, oh wow, I knew it was coming out, but I didn't know it was that fast. Let me click on that little BMW and review those features. So they're reviewing it, seeing the pictures, maybe getting some engineering comments about it. And wow, this would be great to have this new BMW A5. And as they're thinking of, okay, I'm kind of through with that, then a push notification comes up. Donald Trump just got arrested and put in a New York City jail. Oh, I've got to see the handcuffs on him. I've got to see the look on his face. I've got to see what the right says about it, what the left says about it. And then, as they're looking at that, a friend puts a Snapchat there. If you don't see that picture, you're not going to see what the friend's doing at that time. And so you go to the Snapchat. Then another friend is asking you a question about this. Now you've been on your computer a full hour, and you're thinking, why did I get on this to begin with? Oh yeah, my homework. That division of attention starts shrinking down the anterior cingulate gyrus of the frontal lobe. The anterior cingulate gyrus is where we have our working memory. It's where we can have focused attention, but it's also the identical area for managing distressing emotions. And if you cannot focus for prolonged periods of time, it's clear you're not going to manage distressing emotions. And this is why our young people are incapable of managing distressing emotions. Things that are far less problematic than what hit the World War II generation are hitting them, and they're thinking of actually being better off dead. They're thinking about how they can't do this, and they can't, all these can'ts that come up, and all of these things. And it's because of the change that we can even see on MRI of the anterior cingulate gyrus shrinking down. But they actually think they need their smartphone in order to help their mental health. The first lecture we give when people come to our residential program is about technology. Why do we give that? Because we want them to be educated as to why we're taking their technology away from them so they can have focused attention. Many of the people that come to our program say, I would rather not eat for 10 days than you take my phone away from me for 10 days. And don't you realize this is how I treat my mental illness? No, that treatment is only making it worse. And here's the issue. They have a relationship with their phone, but they don't have a good relationship with their mother, their father, their siblings, and they have learned to trust their phone over their loved ones. Let me explain that a little bit. They might ask Dad, what is the population of Garland, Texas? Dad says, I'm not really sure. So then the kid says, Siri, what's the population of Garland, Texas? And Siri gives an answer in the last census. And so the kid thinks, this phone is smarter than Dad. And so then when thoughts come into their mind like, Dad? Or of course they're not going to ask Dad this. They kind of know the answer. But they'll ask Siri, Siri, am I a boy or am I a girl? And Siri will answer back that there are 140,000 genders. And if you want to get onto this site, you can find out actually which one that you are, etc. And Siri's smarter than Dad. And so you go down that rabbit hole for a while, and pretty soon you are ready to transition, and Mom and Dad are kind of shocked. How did this happen? How did this happen? And so you see this marked increase in gender dysphoria, and you see all of these things because it turns out Siri is not very smart about a lot of things. And there's things that get put on the media. For instance, you can find out, I just talked about Eastern meditation. There's a whole lot more Eastern meditation sites that Siri will point you to than there are good cognitive behavioral therapy sites that'll help you be able to correct your irrational thoughts. And that's just one of many examples that we can give. We might have gotten an idea that it's not the healthiest when Steve Jobs would not allow his children to have full access and would limit their access significantly to the smartphone that he had created. And now we're seeing a big shift. Society is now even figuring this out themselves. Sweden, who wanted no child left behind, everyone given an iPad as soon as they show up to first grade. Sweden has now put $100 million into their education system to actually buy them real textbooks, because they find out you can learn far more from real textbooks than you can from a textbook online and all the distracting elements. And they're saying we need to limit technology in order for the brain to actually be fully educated. And we're going to need to do that in order to be able to have it emotionally educated as well and increase our emotional health. So there's so much more. I'm going to just mention this. This was an article in one of the most prestigious scientific journals on depression. In a study conducted in real clinical settings, a common antidepressant produced a response in just under half of the participants and achieved full remission in only what? 28%. It's a little more than 1 in 4 that are going to be significantly helped by all of these drugs that are flying off the shelves. This is the #1 class of drugs sold now in America. 5 decades of work on antidepressant drugs have not made them more likely to lift people out of depression. Medications and psychotherapies help some people with the disease, but fail many others. This is not the way to get out of depression and anxiety. The way is to get to the actual root cause. Shortly after that article came out, we published our article on the real causes of depression and anxiety. And it's not just one cause. Normally there's about 4 different causes or more. There's over 100 causes, definite causes of depression and anxiety. They can be categorized into 10 categories. If 4 or more of these 10 categories are active, depression or anxiety disorder most often results. What does that mean? The brain was created to be pretty resilient. With all the trauma that the great generation went through, they were resilient. They didn't have depression and anxiety because they didn't have enough hits. That was 1. Maybe they had 2 hits. But the more categories involved, the more severe the depression and anxiety tends to be. Finding the causes and eliminating the reversible causes can effectively help in treating depression and anxiety. This is why the first night of someone going to the program that Jared's going to teach you how to put on, they will often have more insight regarding their depression than they've been for years seeing the typical psychiatrists and typical physicians or counselors that have been treating them, because we're going to have them take a screening test to find out what hits are active in them. And these hits can be reversed. We'll talk more about that this weekend. And so depression and anxiety can be completely eliminated. Jared suffered for it for years. He has no depression. He has no anxiety, and he's not on any medicines. The causes were reversed. By the way, if you want to hear Jared's full story, he may not, I don't know if you'll have time to tell your full story, but Hope Channel recently aired it last fall, and it's called Hope at Night. If you look up my name and Hope at Night, you'll see Jared's interview. You can see some other individuals that have gone through our program interview. Many people think depression and anxiety has to be a lifelong illness where you have to continue to see doctors the rest of your life and get this adjusted and that adjusted and all of that. But it's not true. We take those underlying causes away and the brain heals. Our human brain has a wonderful ability to correct itself. Even that anterior cingulate gyrus can come back in full form, and you're going to be able to manage your depression. You're going to be able to focus. You're going to be able to have energy, all of those things. And that's what God wants. He created us to be fulfilled and active and have a purpose. And every brain, as long as it has a little bit of a frontal lobe left, can change for the better. The frontal lobe is the secret of changing. We might have a chance to talk more about that as well. But also I wanted to end in regards to the spiritual aspect, and then I might open it up for a few questions. One of the things that is quite important in treating mental health has to do with the spiritual. So many of our patients that come to our program say, I came here for the biochemical, I came here for the therapy, but the thing that has really transformed me is the spiritual aspect of the program. And the book of Colossians says, set your affections on what? Things above, not on things of the earth. If we can set our affections on the realities of spiritual things above, and also Christ's relationship with us, how we can have that communion with him through devotions and prayer. And that also turns out to be a very important secret to comprehensive self-control, is to have that spiritual aspect. Our program does not neglect the frontal lobe. So many programs, you go to a psych hospital, that's going to be a lobe that is pretty much neglected. They'll talk about the emotional centers, they'll talk about the other centers, but it turns out to have full healing, the frontal lobe has to be in charge of your brain. And that frontal lobe is that spiritual aspect. And so this is a very important aspect. Many people recognize there's going to be a spiritual part of the program, and they're a little reticent. They might be atheists, they might be agnostic, they might be Buddhists, but we haven't had anyone disappointed in the spiritual aspect of the program. And they've seen how it actually works, and it can help transform the brain. And we've had many atheists that have come in as atheists, but without us combating atheism or trying to beat up on them or anything like that, they learn in 10 days there is a God. And they want to have communion with that God and recognize that God's been there all along. They've just been neglecting him, and how actually focusing in on his love for them and his purpose for them can really help transform them as well. Any questions? Yes. Yes, so talking about going to bed at 10 o'clock and then waking up too early. Yeah, you're waking up and ready to go, and it's only been a few hours of sleep. Yeah, felt like you slept a long time. But of course, if you do that night after night, it's eventually going to catch up to you. The first thing that we utilize in our program to reset the circadian rhythm is light therapy. And it's actually the blue light, the same frequency that the blue sky has. And we will put them on a medical grade blue light. That's the first thing we do in our program. When they wake up, they actually wear it. They wear the light, so when they're walking around, they can see that blue light. And that blue light through the eyes, 30 minutes every day at the same time, and they will be ready to sleep through the night after day 7 or 8. So that's one of the therapies that we do to help reset the circadian rhythm, is the light. We want blue light in the morning. We don't want blue light at night. And so we're particular about that as well. And many people have sleep problems because they're looking at blue light at night. They don't realize they are, but every smartphone has it, every computer has it. So we want them, whatever their bedtime is, to put those devices away at least an hour before going to bed. So that way they can help stay on the right circadian rhythm. All right, any other questions? We have a roving microphone so our online audience can hear your question because they might have the same one. He's going to turn on the microphone here for you. Go ahead.
Yes. So many people who have depression usually complain of pain, achiness all over. Where's that pain coming from?
Yes, there is quite an association between chronic pain and depression, and as I mentioned, even greater association between chronic pain and anxiety. And so pain, of course, is perceived in the brain itself. And so if the brain isn't working properly, our pain thresholds can be off significantly. And so it's critically important. Many people have been misdiagnosed with fibromyalgia. By the way, fibromyalgia causes a lot of chronic pain, but fibromyalgia is not a disease. It's a syndrome, and it's caused by something else. And the most common thing that causes fibromyalgia is depression and anxiety. When we get rid of the depression and anxiety, in the majority of fibromyalgia patients, they don't even have it anymore. Their pain is gone. And so it's a crucial aspect. Actually, one of our senior students in our pre-med program about 3 years ago did a study on the pain level of people coming to our WEMAR programs. And he found out that pain level is virtually eliminated in a high percentage of them, and the ones where it's not eliminated, their pain goes down considerably just by improving their physical and mental health. So, and of course that's important for them not to feel a need for opioids and other types of things as well. By the way, anything you want to say? I haven't asked you this, Jared, so I'm putting you on the spot. What happened to your chronic pain from your injuries in the military? Non-existent, he said. Non-existent. So, all right, thank you. Anyone else? All right, well, I'm here this entire weekend, so you can feel free. I'm sure the other questions will come up. Invite your friends and neighbors. They won't be disappointed for 11 a.m. tomorrow when we're talking about emotional intelligence, which is also at an all-time low. Enhancing our emotional intelligence has more with your future happiness and success than any other measurement that we know. And so we'll be talking about even what the Bible has to say about emotional intelligence and do some case reports that can help us to improve that. And then at 5 p.m. tomorrow, we're going to be talking about more of the chemistry in the brain. The brain chemistry, we're going to be taking a look at how medicines work, and also how they don't get to the root of the issue, and why more simple measures can work far more powerfully than medicine. There's multiple randomized controlled trials showing that medicine should be considered alternative medicine. And actually, the real scientific medicine should be non-medical therapies for depression and anxiety. So we'll be showing that evidence tomorrow as well. I will, Pastor Sean, do you want to help it close? Oh, wait, she has one more question there in the back. We'll take it as Pastor Sean comes up to give us our closing prayer.
Oh, online. Will you be talking about memory loss in the near future?
I will be talking about memory loss along with other things at 5 p.m. tomorrow when we talk about the brain chemistry things. So yes, memory loss, also at an all-time high. By the way, Alzheimer's disease, if you take a look at cardiovascular disease is the leading cause of death, which it is. But if we lump all those cardiovascular blood vessel blocked diseases as the number one cause of death, Alzheimer's is now the number 5 cause of death in America. It's being diagnosed at earlier ages. It's a major problem, and it's largely a preventable problem.
Are you going to be addressing PTSD?
We'll be talking about PTSD also at the 11 a.m. hour and a little bit at 5 p.m. So yeah, we'll be going into that, yes.
This is regarding to your sleep topic. Since you said adults need no more than 9 hours, what about naps? Like, let's say you nap for like 2 hours and you sleep for like 6 hours. Since that totals up to 8 hours, would it be okay? Or should we just not
Yes,
take
so
naps?
what about naps? Naps are actually, they should be added to the total sleep time for the day, like you were just doing. But there can be an issue when the naps go through the entire sleep cycle. So far better are what we call power naps, where you're not going into deep sleep and you're not going into REM sleep and dreaming, where you just do a 15 to 20 minute a nap. And because that will start often affecting your ability to sleep at night when you start going through that entire sleep cycle in the daytime. All right. Thank you, Pastor Sean.